It might be the summer breeze, it might be the summer trees, but I'm feeling better now. I'm feeling better. I'm feeling better. I'm feeling better.
It's considered one of the most common physical complaints in the world, affecting 8 out of 10 people, and is one of the most important factors in time lost from work. Well, today on Real Health, we talk about back pain and developing the correct posture to ensure that we either prevent it or minimize it. You're watching Real Health. I'm Stacey Holland, your host, and it's so awesome to be with you again. Well, when I was in university, I was involved in an accident that left me with 2 fractured lower vertebrae. It changed my life. For 10 years after that day, I dealt with chronic pain that eventually radiated down my leg. I always felt uncomfortable, like I needed to be stretched out from head to toe, and at one point I lived on medication to bring some form of relief. Well, I could no longer train at the intensity I was used to, and it went from affecting me physically to emotionally. So the good news though is that today I'm pain-free, but when I hear that 8 out of 10 people suffer with chronic back pain, all I want to do is share what worked for me. Well, to help all of you watching, we've invited into studio Bailey Cockrell. She's a biokineticist, Justine Hunt, a craniosacral therapist, and Angela Hardy, a postural alignment specialist and kinesiologist. Ladies, it's great to have you with us. What are you seeing when patients come through your door in terms of complaints about back pain?
It's, like you say, it's staggering. We have so many people coming through. 8 out of 10 people, and that is such a valid number. It ranges from postural problems, kyphoscoliosis, structural changes in the spine, to degeneration in certain vertebral segments, disc problems, and more severe things as well. But that's the main issue that we generally tend to see on a daily basis.
Are we seeing more upper back pain or lower back pain, or is it sort of evenly distributed?
I think it used to be more lower back pain, but at the moment we're seeing a lot of upper back pain problems as well.
Especially neck problems.
Neck problems.
I think all the computer work people are doing.
Well, I tell you, my neck gets sore because everything is I've had everything is I'm always like stretching and flicking my neck and saying, I need a massage, I need a massage.
100%. Well, if you think about how heavy the head weighs, it's about 5 kilos itself. And if it's off that sort of base of support at a slight angle, it's going to increase that load that you're experiencing through the rest of the structure. So there's actually
quite dramatically, isn't it?
Yes, hugely.
So
it
was it 7 pounds per 5 degrees or 15 degrees?
Oh, wow.
Your numbers.
Geez, yeah.
That's a lot.
You should be texting like this from now
on your bed.
I mean, what are you guys seeing in your practice as well, Jess?
I work a lot with babies and children. I mean, I work with adults as well. But what I've noticed is particularly newborn babies that have got sort of restrictions, or they've had a birth twist pattern, which is natural, that as the head comes out, then the shoulders twist to come out.
Yes.
As the baby comes out, and that imprinting on the dural membrane actually creates a spinal twist pattern, and that often stays in the person's body for the rest of their lives. And we can actually work with releasing it, but if they're not released when they're small or become toddlers or getting older, we find that those adults tend to be the ones that start developing quite bad scoliosis and other problems, because they'll just build a whole range of compensatory mechanisms around that actual dural twist pattern. So especially if they've had ventouse or forceps deliveries and it's compressed and rotated the base of the cranium and the first vertebra, then we find that there'll be compensation patterns all the way down, and the pelvis will be rotated. So I often have little kids coming to me and they can't walk, or their one foot is internally rotating and not the other, and we work with the actual alignment of the base of the cranium and the spine, and everything starts just beautifully stretching out, and they start to balance.
But it almost sounds like all babies would need some form of manipulation.
It can really
be gentle or not.
It can really, really help just to make sure that everything's okay. I've got a lot of people that know me from word of mouth, and they'll just bring their second child because they know I helped the first. Just even if I do one session, we just stretch and release everything, and then we got them for a good start. They're actually aligned now, and then they can grow in a beautiful way and be more balanced and symmetrical.
What's the difference between acute pain and chronic pain, Ange?
Chronic pain is long term.
Yeah.
Acute pain is something that's happening right now. but has a limited period. So
when we say long term, is it a couple of weeks, couple of months?
Anything from, what is it, 6 weeks?
6 months,
Okay.
Yeah.
Okay, then you know that you're dealing
It's starting to become chronic. 3-6 months, you're definitely working with something that could be referred to as chronic pain.
Yeah. One of our biokineticists that came onto the show, Shay Bresler, she was saying that sitting is becoming the new smoking. Everyone is sitting, it's, sedentary lifestyles.
Yes, 100%. Sitting for those long periods of time has such a knock-on effect on so many different levels, not, just structurally. We're talking about fascia getting restricted, at a mitochondrial level, you have energy depreciation, so it affects you so much. So our bodies have been designed to move, so why keep it restricted?
Yeah.
The crazy thing about that is if you think about your workspace in front of a computer where you're spending 8 hours, 10 hours a day, if you think about the space that you're spending in your motor car, if you think about the space that you're occupying in front of your TV, and if you think about all of the things that we're doing in life in order to help us and make life easier, they are again restricting our mobility. We don't have to reach and stretch and bend and lift and, we're limiting our motion all of the time. And if we don't use it, we lose it. So we've created our own personal cage and we're not even questioning whether that's appropriate for us.
Yeah. Is back pain hereditary? Is it something that we inherit from our parents?
I think it can be. There are, certain risk factors.
Yeah, I think genetically, the structure of your pelvis and the actual, obviously arthritis has hereditary factors and those kind of things. But I think a lot of it, I think, is relating to stress, to poor posture or lack of movement, and emotional trauma that hasn't been released from the body, and the body holds on to that as well.
In my practice, I deal a lot with old trauma, emotional content, and how the body's holding that trauma. And you have some sort of impact or you have some sort of emotional trauma, and it doesn't have to be massive. It's how you reference it. It's what it is to you. Your body tucks down, tightens up. You've got to get that spine tightened up so that you don't, have it all wobbly. You've got to get that head tightened down so your brain doesn't rack around inside your skull. You've got to tuck in that tailbone. You've got to tighten up the Achilles. You've got to tighten, and you've got to twist away from the danger. And if that twist gets stuck into the body, then you will spend your time twisted. If it doesn't naturally reset itself, which sometimes it does and sometimes it doesn't. So with my practice, I'm dealing with that trauma that's twisted you up and got stuck emotionally, energetically, and physiologically in the body.
Yeah. Some people say that the thing about back pain is there are known causes, for example, the degenerative conditions that we spoke about now as well, but a lot of people are being diagnosed with fibromyalgia, and neuropathy as well. Are there, or is it becoming a little bit more complex and very difficult to diagnose and treat?
I think we're learning more medicine
as we
and
go
science,
along.
So there's always more information that we need to sort of process. So I think maybe some people tend to over-diagnose maybe sometimes, but as more information comes in, we kind of put the pieces of the puzzle together and go, okay, maybe it's that.
Yeah. Stacey, I think it's interesting that you're saying that, because I think there's a whole new complexity, especially relating to nutrition, and that the fibromyalgia and the effect of inflammation in the body, and general inflammation, and allergies will start to trigger off all of these other issues.
And that's the thing about back pain. I mean, with me, I often thought it was in my back because, I had these 2 fractured lower vertebrae, and only to find out it wasn't mechanical, it was muscular, and it was radiating from my glutes, other parts of my body. That was, an education for me. Part of it was great because I always thought, I had some professionals tell me that my back was stuffed and that I'd have to be careful, and then there were others that were like, no, they had a positive outlook, which was great. But when I knew it was muscular, it actually changed my entire perception. I think half of my pain disappeared by knowing that fact alone. Okay, cool. A couple of massages and stretching or whatever, So again, it's that perception.
And what's interesting actually about pain is that quite often the area that we're experiencing the pain is not the area of the dysfunction. We're experiencing the area of pain in where we compensate for the dysfunction in our body.
And that's that symptomatic treatment, and we need to try and move away from that symptomatic treatment.
Move away from that. You're not treating the shoulder if the problem is in the hip. If the pelvis is misaligned, twisted, forward tilted, whatever the case may be, and that is causing a problem with a rotation, you might feel that in your shoulder when you start playing tennis and you don't have proper rotation in the shoulder. But in fact, it's not coming from there.
So functional treatment, that's the way we're moving to.
And really looking holistically, I can't stress enough that there's so many people that come to me that have seen other physios. and they haven't looked at them holistically. They haven't looked at their entire posture, at how they're functioning and all of that. They just go, oh, you've got a shoulder injury, I'll treat your shoulder.
Very
But they need
isolated.
to look at the pelvis, they need to look at their alignment, they need to stretch out the whole dural membrane, they need to look at everything functioning as a unit.
That's exactly it.
And especially what you're saying, I find with nerve injuries and neuropathies, is that part of the membrane system that is of where it's normally stretching and overcompensating for a major restriction lower down is then where they'll start getting like a brachial plexus injury, or getting neuropathy and pain in the nerves there. But it's actually maybe the restriction somewhere else in the dural membrane that is so adhered or restricted, especially from having something like a lumbar fusion or something like that.
I think we're learning, and that's what I love about the show, is that you can't look at the body in isolation. Everything is linked. So as you've heard, guys, the people at the greatest risk, in fact, are office workers, people who sit for more than 3 hours, and people in manual labor, and even those with flattened or excessively curved lower backs. So when we come back, we find out how our emotions affect the pain that we feel in our body.
I'm feeling better.